Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening to my viewing audience. In with this week's edition of Health Matters is your health educator from the Health Promotion Unit, Shevanee Nisbett. The month of January is recognized as Cervical Cancer Awareness Month, so as a result, I have decided to give a little insight on cervical cancer. Cervical cancer is an unknown type of cancer that develops in a woman's cervix. The cervix is the entrance to the womb from the vagina. Almost all cases of cervical cancer are caused by the human papillomavirus HPV. HPV is a very common virus that often spreads during sex. There are more than 100 different types of HPV, many of which are harmless. However, some types of HPV can disrupt the normal functioning of the cells of the cervix and can eventually trigger the onset of cancer. Two strains of the HPV virus called HPV-16 and HPV-18 are known to be responsible for 70% of all cases of cervical cancer. These types of HPV infection have no symptoms, so many women will not realize they have the infection. However, it is important to be aware that these infections are relatively common and most women who have them don't develop cervical cancer. Using condoms during sex offers some protection against HPV, but it cannot always prevent infection. Symptoms of cervical cancer. Early cervical cancers usually don't cause symptoms. When the cancer grows larger, women may notice abnormal vaginal bleeding. Bleeding that occurs between regular menstrual periods, bleeding after sexual intercourse, douching, or a pelvic exam, menstrual periods that last longer and are heavier than before, bleeding after going through menopause. Women also notice increased vaginal discharge, sometimes with an odor, pelvic pain, or pain during sex. Risk factors or causes for cervical cancer are human papillomavirus, HPV, family history of cervical cancer, age, sexual and reproductive history, socioeconomic status, smoking, HIV infection, in utero DES exposure, long-term use of oral contraceptives. Diagnosis. If you have symptoms of cervical cancer, your doctor will try to find out what's causing the problems. You may have the following tests done. Lab or pap smear tests. The doctor or nurse scrapes a sample of cells from the cervix. For a pap test, the lab checks the sample for cervical cancer cells or abnormal cells that could become cancer later if not treated. For an HPV test, the same or similar sample is tested for HPV infection. HPV can cause cell changes and cervical cancer. Cervical exam. The doctor uses a colposcope to look at the cervix. The colposcope combines a bright light with the magnifying lens to make tissue easier to see. This exam is usually done in the doctor's office or clinic. Tissue sample. The removal of tissue to look for cancer cells is a biopsy. Most women have cervical tissue removed in the doctor's office and usually only local anesthesia is needed. Treatment. Treatment options for women with cervical cancer are surgery, radiation therapy, chemotherapy, or a combination of these methods. The choice of treatment depends mainly on the size of the tumor and whether the cancer has spread. The treatment choice may also depend on whether you would like to become pregnant someday. Many women with cervical cancer will have complications. Complications can arise as a direct result of the cancer or as a side effect of the treatment such as radiotherapy, surgery, and chemotherapy. Complications associated with cervical cancer can range from the relatively minor, such as minor bleeding from the vagina or having to urinate frequently, to life-threatening, such as severe bleeding or kidney failure. Some facts about cervical cancer are: causes and risk factors for cervical cancer have been identified and include HPV, having many sexual partners, smoking, taking birth control pills, and engaging in early sexual contact. HPV infection may cause cervical dysplasia or abnormal growth of cervical cells. Regular pelvic exams and Pap testing can detect precancerous changes in the cervix. Precancerous changes in the cervix may be treated with cryosurgery, cauterization, or laser surgery. The most common symptoms and signs of cervical cancer are abnormal vaginal bleeding, increased vaginal discharge, bleeding after going through menopause, pain during sex, and pelvic pain. Cervical cancer can be diagnosed using a Pap smear or other procedures that sample the cervical tissue. Chest X-rays, CT scan, MRI, and a PET scan may be used to determine the stage of cervical cancer. Cancer of the cervix requires different treatment than cancer that begins in other parts of the uterus. Treatment options for cervical cancer include radiation therapy, surgery, and chemotherapy. 2 vaccines, Gardasil and Cervarix, are available to prevent HPV infection. The prognosis of cervical cancer depends upon the stage and type of cervical cancer and the tumor size. Cervical cancer is most often diagnosed in middle-aged women, with half of those diagnosed between the ages of 35 and 55. Cervical cancer is very rarely seen in women less than 20 years of age, but approximately 20% of cases in women are over 65, demonstrating the necessity of continued screening procedures. The 5-year survival rate of invasive cervical cancer is currently 71%, and improvements in screening and the development of prophylactic vaccines have decreased the incidence of late-stage cancer. The chances of living for at least 5 years after being diagnosed with cervical cancer are: stage 1, 80% to 99%, stage 2, 60% to 90%, stage 3, 30% to 50%, and stage 4, 20%. For your general information, Pap smears can be done at 5 of our 6 health centers here on the island. The days and times are as follows: Charlestown Health Center on Fridays from 8 a.m. to 12 p.m., Brown Hill Health Center Thursdays from 8 a.m. to 12 p.m., Gingerland Health Center on Thursdays from 8 a.m. to 12 p.m., Butler's Health Center Wednesdays from 8 a.m. to 12 p.m., and Combermere Health Center on Wednesdays from 8 a.m. to 12 p.m. This has been this week's edition of Health Matters. I am your host, Shevanee Nisbett, Health Educator from the Health Promotion Unit. Thank you for viewing. The fruit of the week is carambola, or star apple as it is locally called. Star apple is a rich source of vitamin C and other antioxidants. It is also a very low-calorie fruit. This fruit also makes a really good juice, so eat up or drink up at least 1 star apple every day this week.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.